Welcome to the University of Washington Tracheotomy Education module. In this video, we will discuss how to clean a tracheotomy tube site and clean the inner cannula of a trach tube. At the end of this module, you will be able to list the reasons for cleaning the trach site and inner cannula, describe how to clean the trach site, describe how to clean the inner cannula, list and name the equipment needed, list the steps of cleaning the trach site. It is important to keep the tracheotomy site clean. This will help prevent infection of the skin or airway and also make sure that there is minimal odor associated with the trach. Cleaning the inner cannula is important for these reasons and also for keeping the trach tube free of dried mucus and open for breathing. This is an example of a tracheotomy cleaning kit that is available. You may use similar equipment with different packaging. This kit is sterile. It is important to be very clean when handling the tracheotomy tube and inner cannula, although you don't have to be completely sterile. This kit includes Q-tips and cleaning. It also includes cups for saline and peroxide. It is okay to use other cleaning materials that are not specifically packaged for cleaning a trach tube. They do not have to be sterile, but it is important that they are clean. Start by pouring saline into both cups and adding an equal amount of peroxide into one cup. You should then have 1 cup with saline and 1 cup with a 50-50 mixture of saline and peroxide. Use the Q-tips or cotton tip applicators to clean around the trach appliance and flanges and the cleaning brush to clean out the inner cannula. First, remove the inner cannula. This has been reviewed in the module How to Change the Inner Cannula of a Trach. If the inner cannula has adherent mucus, then place it in the cup to soak in 50-50 saline and peroxide solution for a few minutes. This solution will help loosen the adherent mucus. You can soak the inner cannula while you are cleaning the rest of the trach site. Use the cotton-tipped applicators dipped in either solution to clean around the trach and trach flange. Gently lift or tilt the flange and clean the skin under the trach. Use dry Q-tips to remove all the moisture. If your healthcare team has instructed you to place medication around the trach site, this is a good time to do this. Remove the inner cannula from the soaking cup. Use the wire brush to clean any adherent mucus from the outside of the inner cannula. Insert the wire brush into and through the inner cannula opening to clean any adherent mucus that is blocking the inner cannula. When you are finished, rinse any of the peroxide solution away by dipping and rinsing with saline. Replace the inner cannula by inserting it back into the trach tube when finished. Remember that the inner cannula is there to prevent mucus from adhering and blocking the inner surface of the trach tube. So it is important to keep the inner cannula clean, but also important to replace it into the trach tube as soon as possible, so that the trach tube itself does not get dried mucus or mucus plugs in it. In this module, we discussed how to clean the trach tube site and inner cannula.